reconstructive foot, ankle, and leg surgery. I work for Hampton Roads Orthopedics, Sports Medicine. What education courses took in order to be eligible? Basically, I have a major in biology and minor in chemistry. I actually taught anatomy for 2 years and dissection anatomy for 2 years. Daily routine in my job is basically, my day starts about 4:30 in the morning. So I get up, start paperwork, basically get to the office, see patients, do tons of paperwork. I do different things. For example, Monday and Tuesday I'm pretty much in my office. Wednesday I run a clinic at the hospital which specifically does wounds and non-healing wounds. Thursday and Friday are basically in surgery all day. Do a variety of surgeries, everything from reconstructive to trauma to amputations, you name it. How it relates to anything our anatomy and physiology class does. Basically, every time I'm doing surgery, I have to basically know the anatomy. I have to know where I'm cutting, what arteries are there, what muscles are there, what tendons to transfer, what bones I'm cutting, how to realign everything. So it directly correlates with anatomy, because everything I do is based on, where to cut, what not to hit, what nerves not to cut, what arteries not to cut. How long does typical surgery last? Typical surgery lasts anywhere from 1 to 2 hours, but it can vary. The shortest one, a scope, for example, can take 10, 15 minutes, and some surgeries can take up to 8 hours. What's the coolest surgery I've ever performed? I would have to say, it may not seem cool to you, but it was a hunter who shot part of his leg off. So we actually took part of a muscle in his thigh called the gracilis, transferred it down into his leg so we could cover the exposed bone and then skin graft over the top of that. And that was an 8-hour surgery. What procedure is most commonly performed? I do tons of fractures, ankle fractures, a lot of trauma, car accidents. That's probably the most common. Other ones can be tendon repairs, Achilles tendon ruptures, simple things like bunions, things like that. Typical rehab process and what's included. Basically, rehab, once people are healed, is going to be, they go to physical therapy for muscle strength training, gait training, learn basically how to walk again. What made you want to become an orthopedic surgeon? Basically, when I was in college, which was 30 years ago, at that time, everything was different. Some family doctors, their days started at 5 in the morning, went till 10 o'clock at night. I didn't want to do that. I wanted something more of a 9 to 5 type of job. And I grew up on a farm, so orthopedics it's like working with wood, basically. A lot of screws, a lot of hardware, saws, fun stuff. As opposed to sitting in a class, an office all day prescribing medication, to me that was kind of boring. So, most challenging part of the job is definitely paperwork. I'd say on average I spend about 4 or 5 hours a day just doing paperwork, which is the biggest pain. Seeing the patients is the fun part, surgery is the fun part, doing the paperwork is the pain. Why did you go into the foot and ankle profession? Basically same reason. It's more of a 9 to 5 type job. I'm not, most of the time, unless it's an open fracture in the middle of the night, I don't have to leave the house. I can basically take care of everything with the phone and just take care of it in the morning. What age group comes to you most? I would say mainly between 30 to 50. People are pretty much active, out exercising, getting hurt, car accidents, things like that. How to start my practice? Basically, I joined practice when I came out of my residency. It's very, very hard to just open up a first 2 years are basically classroom, and then the third year we start in clinic, we start seeing patients in clinic. Fourth year is almost completely clinic. And then residency, it's all you do, it's just patients. Yes?
How many years of schooling did it take?
It's 4 years, 4 years undergrad, 4 years medical, and then my residency was 4 years long.
So 7.
What?
What?
Where did you do your medical school at?
It's called Case Western in Cleveland.
Any other questions?
Like, how often do you do like triplane fractures? Like,
Triplane fracture? Not that often. I'd say maybe once a month or 2 months, maybe 2 months. Not that common.
So on Thursday and Fridays, like how many surgeries do they schedule you a day?